Have you ever felt a pain so sudden and sharp in your back that it stops you in your tracks? Many people dismiss it as a simple strain, but it could be your body's alarm bell for a kidney stone. Kidney stones can cause some of the most intense pain imaginable, but not all pain patterns are the same. Recognizing specific signs can help you act quickly and avoid complications. This presentation explores 7 distinct pain patterns that may indicate the presence of a kidney stone. Number 1, sharp flank or back pain. A classic and often unforgettable sign of a kidney stone is the sudden onset of severe pain in the flank or back. This pain, medically known as renal colic, isn't a dull ache like a muscle strain. Instead, it's frequently described as a stabbing, sharp, or excruciating sensation that can take your breath away. It typically originates on one side of your body, just below the rib cage, corresponding to the location of the affected kidney. The pain arises because the kidney stone, which is a hard deposit of minerals and salts, begins to move from the kidney into the ureter, the narrow tube connecting the kidney to the bladder. This movement can create a blockage, causing urine to back up and the kidney to swell. This stretching of the kidney capsule, which is rich in nerve endings, is what triggers such intense pain signals. This discomfort can be relentless and constant, or it may come and go in spasms. For many people, the pain is so severe that it's difficult to find any relief, and simple movements don't make it better or worse. Unlike back pain from a muscle problem, which often changes with your posture, the pain from a kidney stone remains severe whether you are sitting, standing, or lying down. This hallmark symptom is often the first and most dramatic clue that something is wrong. So, while this sharp back or side pain is a primary indicator, the stone's journey often creates other types of discomfort. Let's explore how the pain can change as the stone moves. Number 2, pain radiating to the groin or lower abdomen. As the kidney stone continues its journey from the kidney down through the narrow ureter toward the bladder, the location and character of the pain often evolve. A very common pattern is for the pain to migrate or radiate from its starting point in the flank downward, extending into the lower abdomen and groin. For men, this can also include the testicles, and for women, the labia. This phenomenon is known as referred pain. You see, the nerves that supply the kidney and ureter share pathways with nerves that supply the groin and genital areas. When the stone irritates the ureter, the brain interprets these intense pain signals as coming from other areas along that same nerve route. This is why a problem that starts in your kidney can cause significant discomfort in your lower belly or inner thigh. This radiating pain can be deeply confusing and often leads to a wrong diagnosis. Because the pain is felt in the lower abdomen, it can easily be mistaken for stomach issues like appendicitis, diverticulitis, or even a hernia. In women, it might mimic the pain of an ovarian cyst or other gynecological conditions. However, the key difference is often the origin of the pain in the flank and its distinct path as it moves downward. The movement of the stone doesn't just change the location of the pain, it also changes its rhythm, and that brings us to another key pattern. Number 3, colicky, wave-like pain. Many people who have experienced kidney stones don't describe the pain as constant, but rather as coming in intense, powerful waves. This is known as colicky pain, a term used to describe a fluctuating, cramping type of discomfort. This pattern is directly related to the body's efforts to dislodge and pass the stone through the urinary tract. These waves of pain are caused by the normal, rhythmic contractions of the smooth muscle in the walls of the ureter. This process, called peristalsis, is how urine is usually moved from the kidneys to the bladder. When a stone is present, the ureter works much harder, contracting forcefully in an attempt to push the obstruction along. It's during these intense contractions that the pain peaks, creating an agonizing wave that can last anywhere from 20 to 60 minutes. Between these waves, the pain might subside to a more manageable, dull ache, or it could disappear almost completely. This brief break is often followed by another escalating wave of severe pain as the ureter contracts again. This cyclical pattern is a classic sign of renal colic. The intensity of these episodes often causes extreme restlessness. People find it impossible to sit still or find a comfortable position, often pacing the floor or writhing in bed trying to find relief. As the stone gets closer to its final destination, the pain can shift once more, creating a different kind of sensation. Number 4, lower abdominal or pelvic pressure. When a kidney stone has traveled most of the way down the ureter and is about to enter the bladder, the main location of the discomfort can shift again. At this stage, the pain may transform from a sharp, colicky flank pain into a more constant, intense pressure felt deep in the lower abdomen or pelvic region. This sensation happens because the stone is now irritating the very lowest part of the ureter, an area known as the ureter-ovesical junction, where the tube meets the bladder wall. The presence of the stone in this sensitive area can feel like a profound ache or a persistent pressure. Many people describe it as feeling like they have a severe bladder infection or, for women, intense menstrual cramps. The key difference, however, is often the severity and unrelenting nature of the discomfort. While a bladder infection might cause pressure and a dull ache, the pain from a stone lodged in this area is typically much more intense and persistent. It doesn't respond well to simple pain relievers and isn't relieved by emptying the bladder. This shift in sensation from the flank to the pelvis is a strong indicator that the stone has nearly completed its journey through the ureter. This pelvic pressure is also frequently accompanied by noticeable changes in urination, which is another critical warning sign. Number 5, pain with urination or urgency. Once the kidney stone has either reached the lower part of the ureter near the bladder or has actually passed into the bladder itself, it can cause a new set of distressing symptoms directly related to urination. The irritation and inflammation caused by the stone can make the act of urinating itself a painful experience. Many people report a sharp, burning sensation when they try to urinate, a symptom known as dysuria. This can feel very similar to the classic symptom of a urinary tract infection. The stone's presence at the junction between the ureter and bladder or within the bladder itself triggers inflammation that is felt most acutely when urine passes over the irritated tissues. In addition to pain, you might feel a constant and urgent need to urinate, even if you have just emptied your bladder. This feeling of urgency happens because the stone irritates the trigon, a sensitive triangular area in the bladder that signals the brain when it is time to urinate. The stone basically tricks the bladder into thinking it is full, leading to frequent trips to the bathroom. Often, despite the overwhelming urge, you may only be able to produce a very small amount of urine, which can be incredibly frustrating and uncomfortable. And for men, the stone's journey can create another specific and often confusing pain pattern. Number 6, testicular or genital pain in men. In men, a kidney stone can cause a distinct pattern of referred pain that shows up in the testicles, scrotum, or the tip of the penis. This symptom can be particularly alarming and is often a source of confusion, leading men to worry about conditions starting in the testicles themselves, like testicular torsion or an infection. This pain occurs due to the complex network of shared nerve pathways. The nerves that serve the kidneys and ureters, specifically the genitofemoral nerve, also supply sensation to the testicles and surrounding genital area. As the stone travels down the ureter, the irritation triggers pain signals that the brain interprets as coming from the testicles. This pain can be a dull, persistent ache or a sharp, severe pain that radiates into the scrotum. However, a key feature that helps distinguish this from a primary testicular problem is that it almost always occurs along with other classic kidney stone symptoms. The testicular pain is typically accompanied by the hallmark flank or back pain, or it may appear as the pain radiates from the back down toward the groin. A physical examination of the testicles will usually reveal no abnormalities, helping a doctor to pinpoint the kidney stone as the true source of the problem. Beyond just localized pain, a kidney stone can trigger a systemic reaction that affects your entire body. Number 7. Pain associated with nausea and vomiting. The pain from a kidney stone is so severe that it often triggers a full-body response, which commonly includes nausea and vomiting. This symptom is not just a reaction to intense pain, but is also caused by a direct connection between the nerves of the kidneys and the gastrointestinal tract. The kidneys and the digestive system share common nerve pathways through a network called the celiac plexus, or solar plexus. When the kidney sends out intense pain signals because of a stone, these signals can stimulate the nerves that control the stomach and intestines. This stimulation can disrupt normal digestive function, leading to feelings of nausea and, in many cases, bouts of vomiting. This symptom pattern is a classic warning sign of a kidney stone, especially when it occurs alongside the severe, one-sided flank or abdominal pain. Sometimes, the nausea can even begin before the pain reaches its peak. For many healthcare providers, the combination of excruciating colicky flank pain and vomiting is a textbook presentation of renal colic. It signals that the body is under extreme distress from the blockage and pain caused by the stone. Differentiating kidney stone pain from other conditions. The symptoms of a kidney stone can sometimes be confused with other serious medical conditions, making it crucial to recognize the distinguishing features. For example, pain in the right lower abdomen could suggest appendicitis, while pain on the left side might point to diverticulitis. A severe backache could also be mistaken for a simple but debilitating muscle strain. However, kidney stone pain has several unique characteristics. First is its incredibly rapid onset. It often appears suddenly and escalates to maximum intensity within minutes to hours. Second is the colicky, wave-like nature of the pain, which is different from the steady, worsening pain of appendicitis. Finally, the classic radiation of pain, starting in the flank and migrating down toward the groin, is a telltale sign that points strongly toward a kidney stone as the culprit. Other symptoms to watch for. Beyond the distinct pain patterns, several other symptoms can accompany a kidney stone and help confirm the diagnosis. One of the most common signs is blood in the urine, a condition known as hematuria. The urine may appear pink, red, or brown as the stone scrapes against the delicate lining of the urinary tract. You might also notice that your urine appears cloudy or has a strong, foul smell. This can indicate the presence of urinary crystals, or, more seriously, a developing urinary tract infection caused by the blockage. Fever and chills are particularly serious signs. If these symptoms appear alongside kidney stone pain, it may signal that an infection has developed behind the blockage. This is a medical emergency that requires immediate attention to prevent the infection from spreading to the bloodstream. Lastly, you may experience an inability to urinate or find that you are only able to pass a very small amount of urine despite a strong urge. This suggests a significant blockage that needs prompt medical evaluation. When to seek medical help. While some small kidney stones can pass with minimal intervention, certain symptoms should never be ignored. If you experience pain so intense that you cannot find a comfortable position, it is time to see a healthcare provider. The presence of blood in your urine is another clear signal that you need a medical evaluation. Most importantly, if your pain is accompanied by fever and chills, or if you are vomiting and unable to keep fluids down, you must seek immediate medical help. An inability to urinate is also an emergency. Prompt diagnosis and treatment are essential to manage pain effectively and prevent serious complications like a severe infection or long-term kidney damage. Understanding the 7 key pain patterns associated with kidney stones is more than just informative, it can be life-saving. By recognizing whether your pain is sharp and localized to your flank, radiating to your groin, or coming in intense waves, you can better identify a potential kidney stone. If you experience these symptoms, especially with urinary changes or nausea, consult your doctor immediately to get the right diagnosis and care. If you found this article helpful, please share it with friends and family to help raise awareness about these important kidney stone symptoms. Have you or a loved one ever experienced one of these pain patterns? Share your story in the comments below and subscribe for more expert health insights.